Max, it's been a tough old year for us all, but you've got some exciting news about next year.
Yes, indeed. That's right, Sharon. We are holding the next event on June the 28th to the 30th at Imperial College in London. And London in June can be almost as bright and sunny as this lovely Van Gogh picture. And we will be exploring, as you can see, new vistas and new opportunities in a post-COVID world at that event. So I very much hope you can all join us there. So back to now, though. Yes. So back to now, this is the first of two sessions on diagnostics, and we have a really good panel. We've got Jos Lammers, Chief Executive of Unilabs, Wolf Coupat, who's the Chief Executive of Amadis, which is this huge Belgium and German lab group. Dr. Om Manchanda, who's Managing Director at Dr. Lal Path Labs, which is, in fact, the largest Indian lab group, diagnostics lab group, and Chad Malone, who is the Director of Global Medical Information at Abbott Diagnostics. So, welcome, gentlemen. Thank you very much for joining us. So it's been
a pleasure.
Of all the sectors, I think I would characterize the diagnostic lab space as being manic depressive in the course of 2020. You know, there's very sharp V in March and April when people were saying, "Oh my God, where's this going to go?" And then the bounce back in June and July, I guess, when all those contracts from government started to come through for COVID testing. So perhaps we could just start off by looking at, I guess, where we are now. I mean, if we look, Jos, at Unilabs, I mean, I was looking at some numbers from Belgium the other day, and it was saying that Belgium, as a whole, the elective diagnostics lab testing market was still down 5 percentage points, I think, from the previous year. But that was, of course, balanced by a big increase in COVID testing. And I was just wondering, looking perhaps at your 9-month figures, where are we if you split COVID from non-COVID?
Yeah, happy to talk about that, Max. And let's first congratulate you with still organizing this event in what is indeed an extraordinary year for all of us. I think we as a lab group are very privileged to be in the space we are today. Clearly what is happening is, like you said, there was a very sharp decrease in the second half of March. And in April still, the world was a bit in panic and had no clue what to do. And since then, we have basically seen our results recovering. When we take a look at our Q3 numbers, our lab revenues were up with around 2%. This is excluding COVID, so this is just, say, the business as is before any COVID activity. Including COVID, I'll talk about that a bit. And our imaging, as you know, we're a group that prides itself on having laboratory diagnostics as well as imaging diagnostics. And we still saw a slight volume decline in Q3 with around a 5% decrease. But if you take a look at the overall quarter, it was up in terms of revenues with more than 40%. And that is really the additional benefits of COVID testing, where I think governments see that big groups really play a very important role to support the infrastructure that's needed to do the massive amount of COVID tests necessary.
And those are the Q3 3-month figures, not the 9-month not the 9-month figures. That's the Q3 figures. Yes. Yes,
that is the Q3 figures indeed.
Okay.
Yep.
So I interpret from that elective, the traditional lab elective testing at 2% growth is still slightly behind where it would have been had you not had the crisis. You'd have been, because you'd have had organic growth of about 3 or 4%, wouldn't you, to start off with, and then some bit of M&A on top. So, I mean, it's not a bad figure, but there's still been a bit of a hit.
But it's down, clearly down versus our budget. We started the year in January and February with close to 6% organic growth, so like for like. So that was a number we were very pleased with. And then the crisis hit, especially Q2 was very bad and Q1 was impacted, but a remarkable recovery in Q3.
Yeah,
so we
recovery.
count our blessings that we're in a position where we can really help. It's very motivating for all our 15,000 colleagues across the world. It's very motivating for all the co-workers that work with us in adjacent
Yeah.
areas as well as customers. So we're pleased to help.
Yeah. So it's a V-shaped recovery. Okay, fine. So I should have said at the beginning what we were going to be covering in this sector. We're basically going to be looking at the impact of COVID and then the future over the next 6 months, and then looking at whether or not we've seen a system change in the relationship with payers and governments, for example. And then I'm going to ask the panel about the big opportunities that they can see in across the board in diagnostics, and where they would put 10 million euros of their own money in their own business. So I should have said that at the beginning. So, Wolf, what about you? How are the Q3 numbers looking between COVID and non-COVID? Or can you share that with us? Or
Yeah, well, Max. Yeah,
you're private, of
first of
course,
all, good afternoon, everybody. And our situation pretty much is the same roller coaster that Jos has just described. The Amidas Group, however, is not a pure play labs group. We have other businesses, adjacent businesses. We have clinical centers. We have IVF centers. We run a large genetics business, and also in gynecology, the cytology labs. So they're all connected, of course, but the impact of COVID has been slightly different across those businesses. The biggest hit, of course, everything in the hospitals in the first wave. Hospitals had to close to keep the intensive care units, the beds open in reserve for COVID patients. That obviously took us down on sales, in particular in pathology, clinical pathology. The lab has recovered very, very nicely and very strongly. So our base business, the non-COVID business in the lab as well as in the other businesses, is pretty much back on track. So we are growing slightly stronger this year, actually, but this is driven also by strong recovery in Belgium, and strong recovery also in our clinical medicine business. IVF, for some interesting reasons, been very strong this year, and this drives our lab sales as well. So you're asking for numbers, Max. We see that COVID has added somewhere between 20 to 30% to our top line.
wow.
We are running at year to date approximately 1.5 million of PCR tests, and you take this times an average price somewhere between 50 and 60 euros. You can do the math. So that's been quite substantial, and of course the big question, and we're debating this year, is how does the future look like? But for now, to your question, we are quite pleased about the strong recovery and the current track of business.
Right. And Dr. Lal, how's it affected you? I can't hear you. I think you're muted.
Yeah.
That's
So good
right.
afternoon.
Okay, hi.
Yeah, good afternoon to all of you, and thanks, Max, for having me on this panel. I thought briefly I'll tell you about Dr. Lal Path Labs, because it's a little different from Western world. We do not have very high level of sort of penetration of insurance. Most of diagnostics in India is out of pocket, and it's highly fragmented space. There are thousands of labs spread across the country. So it's a highly sort of unorganized play, is only about 15% of the total market. It tends to behave like any sort of a consumer space. A lot of people actually are looking for those kind of retail services. So that's a little bit of an overview of the industry. And Dr. Lal Path Labs is the market leader. We have close to 200 labs and close to 3,000 plus collection centers spread across the country. We are the most sort of a preferred brand as a consumer service brand in healthcare. So that's a broad overview. Coming back to your question, in quarter one, actually, we follow a financial year which starts from April to March. So I think our Q1 is Q2 for a calendar year. So
Right.
in Q1, which is April, May, we saw a sudden fall in our non-COVID business. I think everybody experienced that. There was a bit of panic as to what's going to happen. Then we got approval from the government. We were one of the first labs to be approved for COVID testing. And then, of course, there was a recovery that started, and some bit of shortfall that was coming from non-COVID got made up by COVID. So I think Q1 is not really a representative month, but I think the last quarter that we finished in September, which is July, August, September, we are almost recovered on non-COVID. I think I just see the number. We had done almost 98% of last year number for non-COVID. On the COVID side, I saw that there was a top up of about 17 odd percent, which I think is in the range of which my other co-panelists are mentioning. On the COVID side, pricing is controlled by the state governments. As you may be aware that healthcare in India is a state subject, so each state is determining the price at which the COVID test needs to be sold. It's a little unpredictable sort of a demand pattern. Sometimes it just goes up, sometimes it goes down, depending on how the pandemic is moving. I think on balance, we are last quarter we did close to about 300,000 RT-PCR tests, which is a mainstay of our COVID testing in India. I think on balance, I find that our business last quarter grew at about 18%, which is 98% of the non-COVID, and then balance came from the COVID side.
Yes. So do you have any government contracts, or is the COVID work also basically private individuals paying to get themselves tested?
Yes. So what we saw is that in the first quarter, a lot of business that came in for COVID side came from the government. I think parallelly government expanded a lot of capacity of its own. Then second quarter, we saw a lot of private patients coming directly to us. So the government business went down very sharply in Q2, which is July, August, September. I think government is now managing on its own quite well, and they have really expanded a lot of capacity in testing. So what we are now getting, mostly 90% is actually direct from patients in the private business, which is much more.
And what do you charge for a COVID PCR test in India?
Oh, it's an interesting question. Actually, when we started, if I were to convert in dollars, it was about, I think, close to $60 in the month of April.
Yes. Yep.
Now the prices have almost fallen to about $10 or maybe $8. That's the kind of pricing. And
so
you
started with German pricing, and you've now got Indian pricing.
yes.
Okay, good. Okay, fine. Thank you. Chad, what about Abbott? I mean, you've obviously got a global view of things, haven't you? And you've done a lot of COVID testing, haven't you? So, how's the split between the core business and COVID broke down roughly?
Yeah, I think I come at it from a little different angle, being a manufacturer.
Yes, of course.
What we saw with the first early year surge of COVID in our testing numbers, right, assays and reagents, we saw a precipitous drop, like everyone else did in standard testing for chronic disease or other diseases. Again, with Abbott being as diverse as it is, our non-COVID testing business did see that sharp decline. However, I would say maybe 2 months ago, we hit back to pre-COVID numbers. Now, that being said, I am based in the US, and I'm sure you all read the papers. So, we can assume there's going to be another drop due to this I wouldn't call it a second wave, I call it the continuing first wave with that testing. However, within our rapid and molecular divisions, as well as diabetes care, which I'll speak about in a second, we saw the first 9 months a 313% growth in that business, which, of course, everyone here on the phone, I would hope is utilizing some sort of test from Abbott. So we saw that pull, but we are seeing the U.S. and global diagnostic labs coming back to levels. But as COVID waxes and wanes, I'm sure we're going to see some peaks and troughs. Now, that also leads us to ultimately some challenging issues in healthcare, in the sense of being a physician myself. That drastic drop in non-COVID related testing, is ultimately going to present itself with a worsening chronic care population.
Yes.
So, at Abbott, and that's one of the reasons we saw such a surge in our diabetic division, was ultimately trying to virtualize that care and get outside of the hospital into the home, and then ultimately treat that patient. So I think Abbott really echoes a lot what's going on here, that has been said today. Luckily we did see single digit growth in our core diagnostics business in the first 3 quarters. It's not what we're used to, but in the time of COVID, as everyone here will say, we'll take it.
Yes, yes. Okay, thank you. So of course we're now in this prolongation of the first wave, or maybe it's the second wave. People in England think it's the third wave. And I mean, in the pre-call we were talking about this, weren't we, Wolf, and about how it's impacting Germany, and so we're going into another lockdown. And obviously that's going to presumably affect elective procedures in Germany and Jos in the Netherlands in much the same way. Is it going to affect it in much the same way as the first wave, or do you think it's going to be less of a V trough for you in general in terms of testing in Germany, Wolf?
I believe it's going to be less of a V. It will be less sharp, and it will be less because people have learned to live with that. The way people behave, the way people move, the way people wear the masks. Many doctors' offices and other institutions have installed hygiene measures, have installed all these glass windows to keep the nurses safe, and so on. So I believe people have a more balanced view. There's not so much of a panic as we've seen earlier, when people just were too afraid to even go to the doctors, even in more serious circumstances. There were people suffering from heart attacks, not daring to show up at the doctor's office. We don't see that these days. I think people are more used to taking care of each other, knowing how to behave. So yes, we do some impact, but it's not going to be as dramatic as earlier
As
in
the
March,
first wave.
April of the year.
And you'd echo that, Jos, in terms of your European viewpoint, or I mean.
Also, we anticipate that there will be a second wave, but the impact of that second wave will be nowhere close to the impact of the first wave. People were really panicking, no clue
Yes.
what to do. And now measures are taken, and basically people know what to do. And when we take a look at our weekly volume development, and we see a very gentle decline in countries where there's more strict lockdowns now, but nowhere close to where it used to be. What remains interesting, though, is the differences between countries. As you may know, Max, I work out of Switzerland but live in the Netherlands. And there's a huge contrast between the two countries. As Switzerland is still relatively open, and you can go to a restaurant, etc. Since yesterday, basically, we have a very strict lockdown in the Netherlands, like in Germany. All schools have closed, all shops have closed, with the exception of pharmacies and food stores, etc. And really a recommendation not to go out on the street. So a really stringent lockdown. While in other countries, it's much more liberal yet.
Yes, yes. So yes, it varies from country to country. So before I come to you, to you, Om, I was just wondering. You've won all these new contracts, guys, from the governments, and you have therefore got much closer relationships, in a sense, with the ministries of health. You were both saying, I think, on our last call. Is that going to last? Is that relationship? I mean, presumably COVID is we're going to get vaccinations, and by the summer of 2021, we should be close to being back to normal. I mean, is that stronger relationship with government players, is that going to last? And why do you think it might last, Jos? Or do you think it's going to last?
Yeah, I think there's maybe a couple of points. First of all, we just talked about the differences between countries.
Yes.
I think all countries have realized is that large players can really help in this crisis. We have seen some countries that try to only burden the public healthcare system. We're trying to solve the enormous amount of PCR testing that was coming. And they quickly, or a little bit less quickly, realized that there was no way that the public environment by itself would be able to sort this all out. So I think this crisis shows that big diagnostic groups, and you have 3 on the table and a supplier on the table as well, a very large supplier, can really make an impact in terms of capital, in terms of speed, in terms of the people we put to work. We've literally sent teams from one country to another to support with COVID testing. And also at the supplier relationship, when we have an issue, we typically talk to the board or the CEO of the supplier companies. And well, if you're a local hospital, you have to deal with your local sales rep somewhere down in a country, and that makes a massive difference as well. So big groups really benefit here because they can really provide the speed, the capital the people needed to solve the crisis. And I think we'll have to see how exactly, but I think that effect will last in terms of government relationships. This COVID crisis is not the first. Unfortunately, I think governments will realize that there is much more to come, potentially in the coming decades. And I think this has been a real wake-up call to make sure that there is going to be a very different mindset about how to treat with diagnostics.
So let's move forward a year and assume COVID has more or less gone. And what will they be turning to Unilabs for that they weren't turning to Unilabs before? I mean, I can see the relationship. There might be these nice warm feelings around the relationship, but what are they going to be buying from you which they weren't buying before? How is the your service offering and relationship going to change after COVID?
Was that a question to me, Max? I missed that.
Yes,
sorry.
Yes, it was. Sorry. Yes, it was. Yes, sorry.
Yeah. No. So, for example, we have built a number of what I call extra large pandemic labs in a number of countries.
Yes.
And when we build those labs, they're typically opened by the Minister of Health or the Prime Minister to have that publicity moment as well, for the local politicians to score. And in the background, already discussions are ongoing on how to ensure that whenever there is a crisis next, we can help to be helpful straight away and to have a program ready. Because frankly, what we now saw in this crisis, that everything had to be done from scratch. And I think what this crisis will learn, and also don't underestimate the economic consequences of this crisis. And this is incredibly massive.
Yes.
So government will really, really want to ensure that whenever something happens again, and the plans are ready, that one knows what to do. And it is clear that also big diagnostic players will be involved in that as well.
Okay, fine. Wolf, is that your view as well, or?
Yeah, I completely agree with what Jos just described. I mean, it is very obvious that the perception of labs as an key player, key ingredient to public health has drastically improved. We have access to politicians now. People come to us, they want to talk to us, they want to get our views. We have had an awful lot of requests by the press to give our statements, and we are talking to the Ministry of Health, and in mentioning Germany, of course, but also Belgium. I mean, Belgium they tried in the early stages, tried to run the crisis by themselves from the public health system, but then they very quickly realized they could not do it without the help of the private labs. Now, so currently we enjoy being on the good side and having all these positive attention. However, and this is the other point Joost mentioned, there's a downside. It's a bit of a double-edged sword. We are heading undoubtedly into some economic distress, and sooner or later, all these tremendous amounts of money that public funds and governments now pump into the system at some stage will need to be recovered, and then healthcare cost will come to the center again, and then we need to see how governments will look at labs and the cost, the extra cost, but also the general cost of laboratory diagnostics in the healthcare system, whether all these good relations and all these good perceptions will actually help us to maintain an economic position really interesting, or whether this will be regarded as an opportunity to try and save some money and contain the cost of healthcare. So it's going to be really interesting in the next several months how this plays out.
Yes, what happens? Yeah, what happens to test prices? Yes, yes. So that's fascinating, isn't it? What about you? I mean, it's these guys seem to have the nice problems of dealing with government at the moment. But I know you've really pioneered a B2C consumer testing model, haven't you? I guess your longer term strategy is to go on rolling that out, is it? And to go on with the B2C side of things after COVID, or not?
Yeah. So I think, as you rightly said, that we have a much more retail-oriented model, and what we are seeing is that it's putting a lot of operational stress on all of us, because people want now lots of home visits. They want people to come, phlebotomists to come at their doorstep and collect the samples, and people are getting very comfortable with digital way of ordering and paying online, and then asking phlebotomists to come home. I think that's something which we were already doing, but looks like it's going to become a very large component of our business,
How
and that
large?
really requires.
How large do you think would be?
My gut says it actually might be 15-20% of our business going forward.
20%.
Right now we are, so right now we are, pre-COVID time we were about 6 or 7%, and we are hovering at about now 10%. The pace with which it's moving, it's going to become very significant component of our operations. Now that really puts a lot of operational stress and systems and processes, IT related stuff and consumer apps and all that kind of stuff, whatever goes along with it. I think that's one challenge I see going forward, but I also see an opportunity in the same thing, because any management team that can really leverage this current change in the landscape will obviously be benefit out of this. The other thing that I really see is in terms of logistics network, because our dependence on direct to walk-in patients is going to go down, and we need to embrace larger network of smaller labs, network of hospitals. So what we normally call it as a pickup business. So I think this capability of logistics also needs to get augmented further. So I think broadly, if I were to sum it up, there are lots of challenges and opportunity on the operation side. And I think the second point, which I'm seeing from other co-panelists as well, is I think managing external environment is another challenge which suddenly has come on all the healthcare institutions, not only us. Because on one side you have to deal with the regulator or government, you also have to deal with media. Now there is so much of social media around, and then if people are not happy with the service, you suddenly see a lots of sort of a negative or both positive PR going on social media. So I think overall there's a bit of a pressure on all healthcare institutions to manage external environment. And of course, since it's out of pocket, there is more direct pressure building from the society side. So that's another area which I see becoming a challenge. I think if I were to just sum up, on there are challenges on the operation side and there are challenges on strategic side. I think the strategic challenge that I see is a little bit of a lack of clarity as to what the landscape going to be. Estimating demand on mix on the channel side and how much to invest in labs and how much not to invest, because I don't know whether you're familiar with the Indian geography. We are much more lopsided towards northern eastern part of India.
Yes.
We have to grow on south and west side of India. So we really have to decide how much to invest in our infrastructure. So, but overall, on balance, I do see once the COVID settles down, I think healthcare awareness has gone up to such a level that given that India is highly underserved, underpenetrated from a healthcare perspective, it probably will emerge as a much larger opportunity than what I see today.
And at the moment, you're selling essentially what to the richest 10% or 20% of the population, or I mean, $8 to $10 doesn't sound much for a PCR test, but I mean, if you put that into Indian wages, of course, it's it's a lot of money, isn't it, compared to 50 euros in Germany, which is a couple of hours' work, isn't it? Really, if that's for I mean, not that the individual's paying it anyway. So,
yes, I think our basically customer base is, if I were to put in a pyramid shape, clearly it is top of the pyramid. At the bottom of the pyramid, which is smaller towns and rural areas, still it's being serviced by smaller labs. So our customer base is definitely at the upper end of the society, clearly, or maybe moving a little bit to the middle, but definitely bottom is still served by smaller labs.
yes, so you're constantly trying to demonstrate why they should be paying a bit more for your brand compared to some cutthroat low-priced offer from a smaller mom-and-pop player. Yeah.
Yes, absolutely.
Very different model, isn't it? That's fascinating. So do you at Abbott, Chad? I mean, has it changed your relationship with governments? I guess it probably has, hasn't it? I mean, they're more inclined to listen to you, or
Well,
not?
you know, I do have a few interesting comments, and this may be the gospel according to Chad, but I think it's very interesting to see how, at least in the United States, the view of a lab has been a commodity. Even though Abbott is an incredibly innovative company, still in the domain of public opinion, we're not Silicon Valley. We're not the innovators, by perception. However, I really think what's happened now is with the governments having to make quick moves, just as Joss said, they're starting to look at this sector differently. And I believe that our relations, and Abbott does, have major relations with the majority of the governments around the world, that those will just strengthen. I would hope that the infrastructure that is created within the government side to deal with an outbreak like this will stay and get stronger and become canon in their public health policy. Now, as we moved forward with our first test, and then our second test, and then our rapid test, and as we really started to innovate, one of the issues that we face is ultimately supply chain. And to watch Abbott go in a few months to delivering millions, hundreds of millions of tests in a few months. I mean, just I'm based in Chicago, and about 10 miles away from my house, we hired 2,000 employees and set up a new distribution hub and test manufacturing area, right? So I do think and would hope that in the realm of public opinion, that the laboratory, as well as companies like ourselves that supply that vital institution, kind of break out of that commodity view and into that innovation view. So, I see this as I would hope, as a framework to move forward so that we can both serve the government entities as well as the private entities and deliver world-class testing through our partners that are on this
Yeah.
call, to be able to meet that public demand. So it has been very interesting to watch, our company be on the news every other day, which, we usually didn't see that. But this has brought a spotlight. Yeah, this has brought a spotlight on the critical nature of research and development, of quick turnaround of tests that have efficacy, and then ultimately getting those tests to our partners here on the phone.
So is there an opportunity then to talk more widely about testing, and to look more widely and to say, well, these are the kind of tests we should be doing, because if we do these tests, then we can prevent, the notion of prevention. I know that there are all these tests which are coming up now which can detect cancer. So I guess maybe the door is more open to those kind of tests perhaps than it would have been before, or not.
Yeah, I would hope that that view of what we do has changed, and that as we continue to innovate, as you mentioned, in the oncology realm, in the cardiology realm, and the things that we do, that we can be viewed as an innovator, and ultimately, I think for me selfishly, as a patient-centric, vital healthcare partner.
Right. Yes. Yeah. And is that true for you as well, Jos? That this idea that you can have a broader debate about testing with policymakers and governments, which goes beyond COVID and starts to think about prevention, or is this? Am I being very optimistic?
Yeah, we would aim for that, but it's, I think, fair to say that the governments are still so much in the midst of trying to sort out what to do in the COVID crisis. It really has to big attention now. So the future will tell, but clearly we will push for that. But what we see, and I think what we conclude in this meeting so far, is that really the big groups, can really help and benefit. That governments' relationships have really changed, and we think that will last, because this is unfortunately a pandemic that is very worldwide, has enormous consequences. Yes. We'll want to be prepared. And we also believe that digital will make a big impact. You've just touched on this as well, Max. We were talking about this in the chat just before this part of the conference. But a sentence that I never used last year and I've used many times already is "You're still on mute." And we all have come to live with the fact that many things go much more digital, whether it's ordering stuff, or whether it's talking to colleagues, or whether it's providing test results of diagnostics. The world has really changed, I think, in that respect. And where I personally, for example, made 150, 200 flights a year, that has basically come down to a grinding halt. And I've also learned personally that a lot can be done, although not always ideal, via the various tools that are available now. And clearly that is the same with our customers. Interestingly, some of our customers are even easier to approach now, because everybody was in the mindset of having a physical meeting and finding time in the agenda. But a quick 10-minute chat can always be slotted in. So there's a lot more flexibility, I think, coming to the world as well in a way. We will use that to good benefits as well.
Okay, good. So I think it'd be interesting really for the audience to know what you see as the biggest opportunities, guys. So if you had $10 million, and I know you've all got more than $10 million, let's imagine you've all got $10 million. So where would you put the $10 million if you were going to invest in your business? Are you going to put it into, where's the biggest opportunity? Jos?
Well, I think it's a number of things. I'm going to be on one pretty specific, and on another point a bit more philosophic. On the specific point, I believe that investing in digital innovation is really key now. And as you know, we have invested in this quite a bit already with the acquisition of TMC, for example. Max, which is non-COVID related, but is really
Yes.
a clear sign for us to invest in that digital transfer of knowledge, which really helps us to get better results and more productive as well, especially in pathology as well as radiology. The more philosophic point is on teams and colleagues. We as a company spend a lot of time, money, and effort on ensuring we have a culture that really works well for our people. And you've been kind enough to offer us the opportunity to talk about this in your physical HBI conferences in the past. So what we have seen in this crisis again is that an enormous amount of people have really stepped up. We have just literally earlier this week received the results of our annual employee satisfaction survey. And surprisingly, results in terms of response and engagement were up tremendously on what was already a very good level. So this clearly is really a very motivational time for all our colleagues as well. And we see our good people totally stepping up the plate and doing an enormous amount of work with joy as well, realizing not only like governments do that we really play an important role here, but also feeling and seeing that they can really help and serve patients well.
Okay, and very briefly, when you say you invest in digital, what precise aspects of digital do you invest in with your $10 million? Better communications with doctors or?
Yeah, customer connection, where clearly we can do a lot of digital. Still, there's quite a bit of paperwork left, right, and center. And secondarily, as you know, for example, in our radiology, we have all our more than 500 radiologists connected on one platform.
The teleradiology platform.
Yeah, exactly, which really enables more precision, measurably better quality, and measurably better productivity as well, because all our radiologists subspecialize and we do secondary testing on every 1 out of 10 exams.
Right, okay. And Wolf, what about you? I'm giving you $10 million. Spend it well.
Yeah, well, a lot of what's on my mind is also on Jos's mind. I mean, the IT backbone, the IT infrastructure, connectivity, digital communication, order entry, all these systems need extra investment and could clearly benefit from strengthening efforts. So I'd also like to, and Max, we have a second session coming up, and we will ask about the investments in the next session as well. Our group clearly is on a strategic roadmap to higher specialization, and we clearly see the value of investing in high-tech procedures, in high-tech lab diagnostic testing. So that's, I don't want to dwell on that too much, but I'd like to make one additional comment to what Chad said. And this is the huge opportunity, and it probably deserves not only lip service, but also some extra money. We have created a lot of positive notions around lab diagnostics, about the healthcare industry in the wider sense. Look at the interest about vaccination these days. I mean, who 12 months back would have ever thought of investing into a vaccine company? Who would even think about that? This might be a big game changer. Now that has changed. And I hope we can keep up the momentum. And to do that, I would also take a few bucks of your 10 million, Max, and try to keep the PR momentum and the interest up as we have seen it recently. So.
And when you were talking about digital communications there, Wolf, I mean, the truth isn't the truth that most doctors, when they get test results, they'll look at whether it's positive or negative, and they'll think they understand them even if they don't. And if they really want to ask a question, they'll expect to pick up the phone and talk to a specialist doctor in your labs. And therefore you can invest a lot of money in a digital platform which enables you to display more accurately the result, more clearly the results to a doctor, but are they actually going to use that, or aren't they just going to ignore it?
And these are two, Max. These are two different things. One, you are absolutely right. There needs to be a channel to talk to somebody because it's about trust, it's about relationship, it's about can I ask the questions I wouldn't dare to ask in open public. That's for sure, and we need to keep that. But what I'm talking about, I mean, if you look at the infrastructure, and COVID has mercilessly drawn this to the forefront in the German healthcare system. And remember, we are one of the more advanced industrial nations on this planet.
Yes.
Communication with public health services is still like the Stone Age. We are using fax, we are using lots of paper, we have totally outdated systems. So to create the infrastructure in the wider healthcare system, but also within the company to be able to address all these needs, the amount of megabytes that need to be transferred all the time. Labs and lab groups traditionally are not very well prepared for that.
Yeah.
So a part of your money would clearly go into that IT digital backbone.
Into solving the very basic problems.
Well.
Yes. Okay.
Yeah.
And what about you? We've got a few extra minutes, so don't worry too much about the clock ticking down there. What about you? Where would you invest your $10 million? Is it going to go onto infrastructure and logistics, or are you going to spend it on branding? Or
So interesting. So I think clearly I see COVID has disrupted the industry. And there are two areas where I would put this money. Number one is patient behavior has changed. The way they consult doctors, the way the OPDs in India, I think that behavior has changed. So I will try and change the operating model of our company. As I mentioned earlier, a lot of this home health, home service side of business is going to grow. And I'll have to support that side of business, which includes doorstep phlebotomists, aggregating a lot of phlebotomists across the country and supporting it through a digital way of doing business. So I think I'll go with the group, what they're saying, that investment more behind IT and digital stuff, and which also would mean a lot of these legacy companies, traditional companies, especially the medical talent, is not really tech savvy. So I'll invest a lot behind training and improving or enhancing digital quotient of my people. Because a lot of people in the boardroom, in the conference room, we all know what is to be done, but we don't know who is going to do it. So we need to actually hire a lot of talent and bring it from outside. And that also will require a lot of sort of a change management within the organization. I think if I were to sum it, it's both organizational renewal as well as personal renewal. Both will have to go hand in hand.
right. Okay.
The second area where I'll put the money is, the lab industry worldwide actually has depended quite a bit on consolidation, right? Which is traditional M&A kind of stuff. I find that might take a little bit of backseat because legacy brick and mortar model are going to get disrupted. It's a digital way of working which is going to win. So I'm not very sure whether inorganic way alone will actually bring the consolidation. It probably maybe organic way of consolidating the industry also might become the most important thing.
So more greenfield development, more digital platforms, maybe less buying up of competitors. Yeah.
I would say combination of both. You actually would drive shift from smaller players to large players through this new operating model.
Yes, sure. Okay, what about you, Chad? Here's $10 million. I know that's a lot of money for Abbott, but so treat it carefully.
Sounds good. Well, I really have two areas, right? We didn't get into this business, and I don't think Abbott does this business not to help patients. And as everyone here has said around the digital side, Abbott has invested and continues to invest in the informatics side. So there is a full, what we deem as a holistic disease management platform for physicians. Of course, lab data, as we know, I'm an anesthesiologist, and the majority of the decisions I make is based on lab data, right? So it isn't too far afield. But here's what the real tragedy is, everyone, in my mind. COVID is a tragedy, but the real COVID tragedy is the chronic care population, the acute emergency population that is not getting care during this time. There was just a recent paper published that showed within our 5 hardest hit states in the US for diabetics and cardiovascular patients, 41% of them are not receiving care. They're avoiding care. But more importantly, the non-respiratory related mortality is up by 89 to 93%. That's the tragedy.
The non-respiratory mortality is up by 88 to 93%. So, in other words, non-COVID deaths, the non-COVID death rate, more or less, has doubled. It's nearly all but doubled. Really?
And it's due to the fact of they're not receiving care and the lack of virtualization of care. So we have invested and will continue to invest with this platform that does contain clinical decision support. So to your a question earlier about communication with the lab, right? How do we guide physicians around standards of care to reduce care variability and drive guidelines? And then remote patient monitoring. There are blood pressure cuffs, glucometers, Apple Health data that we connect with to bring in what is happening externally to catch these patients before they have an adverse event. So that's really one area that I believe we all have to invest in. Number 2, and I'm going to go a little different here. I think pharmacogenomics market is going to be very big here soon. We're, within the U.S., just one population, about 65 million Americans could benefit from pharmacogenomics testing around drug efficacy and other things. So, the one is really that digitization, virtualization of care, and number 2 is kind of an emerging market to help drive better care through pharmacogenomics.
Pharmacogenomics being so if you've got cancer, it can tell you whether you are going to benefit from using a particular pharmaceutical. Yes.
Well, for example, Plavix, the great heart drug for anticoagulation, 23% of the population does not have the right cytochrome P450 to metabolize it so it works. So imagine a quick test to say, yes, this drug will work, this drug won't, and it allows the clinician to really, right at the point of care, optimize that prescribing habit.
And that's not being rolled out yet. It's not there yet at the moment. It's not being.
No, we're seeing it in the U.S. where people are starting to do this, but the current market for this is about 5.3 billion. It's slated to grow to 10.2 billion by 2025. So it is something I think myself as a clinician would have benefited from had I had it at the point of care.
Right. Okay. Well, gentlemen, thank you very much indeed for your time. I think we've had a good kickabout, haven't we? So thank you very much, and I look forward to meeting you again, all of you, soon. Thank you. Okay. Bye.
All right.
Thank you, Max. Thanks a lot.
Thanks.
Bye. Bye.
Hit the slide. Okay. Phoebe, thank you so much. Right, we're going into a short break now. Do please remember to leave your feedback on the sessions you've seen. You can do by clicking on the session and following the bright green link. You should probably know that by now, as I'm guessing you've done it a number of occasions. Please do come back soon for part 2 of Diagnostics. Just after 2 o'clock. We look forward to seeing you then. Thanks.